Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we are taking an in-depth look at inflammatory bowel disease, commonly known as IBD. For the millions of individuals navigating ulcerative colitis or Crohn's disease, the unpredictable flares, your tense abdominal pain, and associated exhaustion are a challenging daily reality.
That is precisely why Pennsylvania included inflammatory bowel disease as an explicit qualifying condition from day one of the Medical Marijuana Act. As we explain at PennsylvaniaMarijuanaCards.com, the law even features a unique statutory pathway where Crohn's disease is listed both under the broader IBD category and as its own completely separate qualifying entry, reflecting its complex clinical profile.
That really shows a deep legislative understanding of the condition. But your guide points out a massive scientific nuance regarding how cannabis actually interacts with the gut. Let's talk about the critical difference between a clinical response and an endoscopic response. Why does this matter so much for an IBD patient?
This is the single most important concept for anyone considering a PA-MMJ card for IBD. Clinical response means the patient feels significantly better, less visceral pain, fewer bowel movements, and improved sleep. Endoscopic response, on the other hand, means the gut's mucosal lining is objectively healing under a colonoscopy. Landmark randomized controlled trials published in PLOS One revealed that while cannabis dramatically reduces subjective symptoms, it does not consistently heal objective mucosal inflammation or lower stool inflammatory markers.
Wow! So a patient might feel completely fine on the surface, but the underlying inflammation could still be damaging the tissue. That means cannabis is an outstanding symptom manager, but it is not a cure or a disease modifier.
Exactly. Cannabis should never be used to replace your core disease-modifying therapies, like biologics or immunosuppressants. Relying on cannabis alone can create a dangerous symptom-inflammation mismatch, which could accidentally delay necessary escalations in your medical care. However, as a real-world quality-of-life companion, the data from the UK Medical Cannabis Registry shows exceptional, sustained improvements in sleep, anxiety, and daily functioning over an 18-month period.
That is incredibly valuable framing. Now, let's look at drug-drug interactions, because IBD patients are often on complex medication regimens. Let's start with advanced biologic therapies like Humira, Remicade, or Entyvio. What does the pharmacology show here?
The data here is incredibly reassuring. Biologics are monoclonal antibodies, meaning they are processed through protein catabolism rather than the liver's cytochrome P450 enzyme system. Because of this, published reviews confirm there are no predictable pharmacokinetic interactions between cannabis and biologics. For the vast majority of patients on these advanced therapies, co-administration carries an exceptionally low risk.
That is fantastic news for patients on biologics. But what about other standard treatments, like oral JAK inhibitors, such as Rinvoq or Xeljanz, and immunomodulators like Azathioprine? What are the clinical watch points there?
Those require closer attention. JAK inhibitors are heavily metabolized by the liver's CYP3A4 pathway. Because THC can inhibit this specific enzyme, it could theoretically raise your medication levels, which warrants an open discussion with your gastroenterologist. Additionally, immunomodulators like azathioprine aren't a direct liver risk, but because THC naturally relaxes the gut and slows gastric emptying, it can subtly alter how and when your body absorbs those oral medications.
Incredible. This highlights exactly why having an open, multidisciplinary care team is so vital. How should a patient approach product selection at a Pennsylvania dispensary to target these symptoms safely? For chronic cramping and visceral abdominal pain, low-dose THC-dominant oral tinctures or capsules taken with a small amount of healthy fat provide the most consistent, long-lasting absorption through the GI tract. For acute spikes of nausea, sublingual tinctures are preferred for faster onset. For pure IBD-related anxiety, high-dose CBD-dominant products are excellent. And if you are on a JAK inhibitor or transitioning away from prescription opioids, you should always start with the lowest possible dispensary dose. Perfect safety logic. So, if a resident is ready to safely explore a state medical certification through our telehealth practice, how does the process work?
We provide a highly secure, completely remote pathway. Step 1 is filling out our quick 3-minute pre-qualification form at PennsylvaniaMarijuanaCards.com. Step 2 is a private, secure telehealth evaluation via video right from your home. You'll meet directly with a state-registered medical provider, like Dr. Jonathan Chance Miller. His official NPI number and state licensing credentials are fully transparent and listed right on our website for complete medical integrity.
And your clinic honors that identical protective medical standard. If for any reason the medical team reviews their records and decides cannabis isn't a safe fit for their specific gastrointestinal regimen, there's no financial risk.
Absolutely. If our physicians find that cannabis poses an unacceptable risk alongside your current prescription therapies, or if you don't meet the state's clinical criteria, your $159 evaluation fee is fully and immediately refunded. If approved, Step 3 is seamless. We file your state certification the very same day. We also guide patients step by step on how to request state registration fee waivers if they are enrolled in assistance programs like Medicaid, SNAP, or WIC.
Comprehensive clinical honesty, rigorous drug safety education, and absolutely zero financial risk. An extraordinary resource for the IBD community in Pennsylvania.
Thank you. If you are ready to explore medically guided, risk-free symptom relief for IBD-related pain, urgency, nausea, or sleep disruption, visit PennsylvaniaMarijuanaCards.com. Fill out the form at the top of our page and let our compassionate medical team take care of you today.
Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening and take care.